Yes, sir, tell me. Oh, the question you are having that time.
As it is often said, you shall live in the present moment. That you first have to be in the moment. You have to be stabilized yourself. Your focus has to be there on the patient. You shall not have lot many thoughts or any thoughts for sure. Once you are stable, you are not carrying the thoughts, so you can treat the patient better. I infer the whole idea is on the focus, or we are trying to see the things, or we are trying to palpate the things, or we are trying to feel the things. So once we are trying to feel, the focus makes the difference. So in case the client also focuses under my hands, under the hands of the therapist, then that makes more sense. So we can get his focus also there, though he is restless. I'm not talking 100% of the patients would be able to focus. They are themselves in a restless position. They have come to us for the solution, and we are asking them to focus here, though they have come to us for some musculoskeletal problem. Would it make sense in
Yeah.
case we include them also
Yeah, I was about to come that
into
point.
the
So, what your question
Yeah.
is, my understanding that
Yes.
when we are going for that zone, when we are not focusing on any thoughts, we are focusing on what we are feeling, but we are not engaging with our thoughts. It's like empty mind.
empty mind?
So when
Yes.
we are on that stage, we are getting good result. But at the same
Yes.
time, if we can convince our patient to becoming neutral, then both if we are involved, the result will be much more better. But sometimes what happens due to some circumstances, or might be they have some other issue, they are not be able to 100% relax or not be able to maintain in a neutral state.
Yes.
So when this kind of patients are coming to me, like year, 2 years back, that time I start digging this thing, that how can I convince them that they should be in a neutral state. So one day I was reading one book. It's a psychologist. His name is Spiegel. So he created a technique. It's called Spiegel eye roll technique. So what he was doing, he was kind of taking the patient in a state where patient don't have much control on their thoughts, and it's a very simple and it's like 2 minutes time to take the patient in a different level. Means you just cut down the thoughts. So what I generally do to the patient, look at my finger when they're lying down on the bed. I just tell them, look at my finger and see how much you can see my finger. They are going up, 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 up. And after a certain level, they're not be able to see my finger. And at the same time, I told them, your eyeball should go up as much as you can. And after a certain level, when they are not able to see, they start feeling their cranial nerves,
Motor, trochlear, abducent, and facial nerve.
the classes with each other, and they cut down all other thoughts they have. So they just suddenly got into neutral zone. Then I start working on occipital release and other release. So I getting better results. But it's a temporary trick to make them on that stage so that you can start your work. So this technique you can also try. It's called Spiegel eye roll technique. It's a very useful technique I use for.
That's wonderful.
Yeah.
So basically, let's say someone is at neutral 0, someone is below neutral into something minus. Some people are into plus.
Yeah.
So to cut down the senses from the whatever the mind is getting stimulated from, and 80% of the this thing is from vision. The input to the brain or the stimulus to the brain is through the vision. So possibly through this technique you have cut down that.
It's a temporary phase. That
We need
we
only
just
a
it works for 2-3 minutes, but that is the entry point for you.
yes. So it will
To work his
open
system.
the door
Yeah.
into his system
Yes, it's
by
the
cutting down his
thoughts,
thoughts,
engagement with the thoughts.
engagement with thoughts, and the input which he has imbibed.
I will give you the details. What are the nerves are working for that?
So basically the input has to be decreased.
Yes. he was just reducing the threshold. Like if you ever think in this way, patients who are going through lot of stress, anxiety, their mind is like puzzled. They are always thinking here and there.
Yes,
So
flickering.
it's like
vaporizing. So many thoughts are
radar
vaporizing.
system.
Yes.
They're always scanning all this information,
Yes.
whatever is coming.
Hmm.
If it is important, then it's also fine. If it is not important, then also they are processing those things.
Still
And
is confusing.
when they are processing those things, fourth part of your brain, they are super active.
Oh.
Prefrontal cortex, anterior cingulate cortex, second and third corticals, and amygdala. These four areas of our brain, they are like brother and sister. They just collect the data and share with each other.
Wonderful.
And then what they
I'd like to try out the technique. What did you say?
Yeah.
The
spittle eye roll technique.
Spittle eye
Spittle
roll
eye roll
technique.
technique.
Okay. Can I?
Open your eyes. Open your finger. See the finger? You have to follow it as much as you can. It will be difficult. That's fine. Difficult? Difficult? Difficult?
No, I can't see.
Okay, now slowly close your eyes. Close your eyes. Don't open. This is the moment you have to enter. Don't open your eyes. So this is how you have to enter. Let's look at your eye. Please come on this side. Open your eyes. Normal. What you sir? It's red. So you are going into parasympathetic. It's like a quick fix, but not a solution. But in this way you can enter. This is where
And it has to be done towards the cranial, not towards
Not
the
down.
foot.
going up. And your eyeballs will be going up, as much as you can see, and then slowly you have to close your eyes and don't open.
And then one can enter.
Yes, and then you have to focus on your breathing. And your patient is not going to open the eyes for 2-3 minutes. Then if he can, then he won't. Then it's fine.
So he has to lie down for 2 minutes, 3
No,
minutes.
then you can start your whatever you want to do. Cranial,
Immediately after that?
something like
Once
immediately after that.
he has
Because
closed
that
the
time
eyes.
you just block the signals.
Right.
Now you have to work to take the patient into hypnagogia state, where your brain is like sympathetic and parasympathetic in between.
Right.